you know someone who has had or survived cancer? Well, if you don't, now you do. I was diagnosed with a childhood cancer when I was very young, and I want to inform you about it. It is called Wilms tumor. It can also be called nephroblastoma. I have learned a lot about it through my own experience and through research. So I want to explain the causes, prevention, symptoms, treatment and stages, and my experience with it. First is the causes. There is no known cause at this time and no known birth defects that cause it. But according to Medline Plus, it is associated with certain birth defects including urinary tract abnormalities, absence of the iris, and hemihypertrophy. It is most common in siblings, twins, African Americans, and girls, and the peak time of occurrence is 3 to 3.5 years of age according to the American Cancer Society. Next, prevention. Since there's not a known cause, there's no way that the mother can prevent it. But if your child has some of the birth defects associated with it, or there's a relative who has had it, then you need to tell your doctor so you can get regular ultrasounds. Next is symptoms. Symptoms may include abdominal pain, swelling in the abdomen, blood and urine, fever, loss of appetite, nausea, vomiting, general discomfort, high blood pressure, constipation, and an increased growth on one side of the body. According to eMedicine, only 30 to 40% of patients have abdominal pain, and the most common symptom is the swelling in the abdomen. Next is the treatment and stages. When first diagnosed, they look at the cancer cells underneath a microscope to determine whether it's favorable or unfavorable. If it's favorable, there will be no signs of anaplasia. Unfavorable, the nuclei are large and distorted, and the cells are not uniform. This is a graph that shows the different stages. There are 5 stages of Wilms tumor that get worse as it goes on. First stage affects about 42% of all patients. It occurs in just one kidney, and the renal capsule is not broken. The 4-year survival rate, if it's favorable, is 96%, and for unfavorable is 93%. The treatment is nephrectomy, which is the removal of one kidney, and about 18 weeks of chemotherapy. Next is stage 2, which affects about 22% of Wilms tumor patients. This is when it's not only in the kidney, it is also in the fatty tissue or blood vessels that are around the kidney. It is completely removed through surgery though. The survival rate for favorable is 91% and 70% if it's unfavorable. The treatment is surgery, radiation, and about 24 weeks of chemotherapy. Stage 3 also affects about 22% of patients. This is when it moves to the lymph nodes around the kidney, or the edge of tissue around the kidney that is removed, or if it spills into the abdomen. It is not completely removed by surgery, and the survival rate for favorable is 91% and 56% for unfavorable. The treatment is radiation, 24 weeks of chemotherapy, and then surgery. In this stage, they do the surgery last because they want to try to shrink it first. Next is stage 4, which affects about 9% of patients. This is when it moves to other organs, which are usually either the lungs, the liver, or bone, or it can move to lymph nodes that are far from the kidney. The survival rate, if it's favorable, is 81% and 17% if it's unfavorable. The treatment is surgery, and then radiation, 24 weeks of chemotherapy, and then radiation on the other lymph nodes or the other organs. The next stage is stage 5, which affects about 5% of Wilms tumor patients, and it is bilateral, which means it's on both sides of the body, so it's in both kidneys, and the survival rate for favorable is 82%, and there's no percentage for unfavorable at this time. The treatment varies between different patients and how bad it is, but it will most likely always include chemotherapy and radiation. Next is my own experience with it. I was diagnosed when I was 2.5 years old because my mom was rubbing my stomach and felt the inflammation of one of my kidneys. She took me to the doctor and we got it taken care of, but then it reoccurred in my lungs, and so I was stage 4. Now I've had more radiation, and I go for regular checkups to get ultrasounds, and I'm just left with 1 kidney and a couple scars. So from all this, I hope you know more about Wilms tumor and childhood cancers, because I've explained the causes, prevention, symptoms, treatment and stages, and I've told you my own experience with it.